Good afternoon, everybody. I just received my first dose of the vaccine here at the Hynes Convention Center's mass vaccination site. Process was quick and easy, and I feel fine. I want to thank all the partners that are involved in making this site happen, including CIC Health and FEMA, for running this massive operation. I want to give a quick update on the latest COVID data before I talk a little more about my experience. Yesterday, the Department of Public Health reported 2 days' worth of data and reported 2,912 new COVID cases. That was on 113,587 new molecular tests for those 2 days. And we've now done more than 19.2 million tests here in Massachusetts. 707 patients are in the hospital being treated for COVID, and 163 are in the ICU. I think it's important for everybody to know that cases among younger people, when I say younger in this particular case, I'm talking under the age of 50, make up a far greater share of total cases than they did previously. And cases among older adults, those over the age of 60, have declined pretty dramatically. Over 4 million doses of vaccine have been administered here in the Commonwealth, and today we'll hit the milestone of having over 1.5 million people who are fully vaccinated. We're making significant progress on vaccinating our residents, and we continue to lead the nation in administering doses among all 24 states with more than 5 million people. And we continue to be in the top 10 of all states for doses administered. 82% of residents 75 and older have received a first dose, which is significantly above the national average of 76%. And we're one of 13 states that have vaccinated over 80% of our 75-plus population. 24% of black residents and 16% of Hispanic residents have received a first dose, and that's about double the national average for both of those populations. We obviously have more work to do, but we're making significant progress on vaccinating a larger and larger share of our population, which will help us get closer to returning to normal. On Monday, individuals 55 and older and those with one qualifying medical condition became eligible to book an appointment. We also updated the list of qualifying health conditions to align with a recent update from the CDC to add certain medical conditions such as type 1 diabetes and cystic fibrosis. That means that an additional 1 million people are now eligible to get vaccinated starting this week. Our goal is to make sure that every person in the Commonwealth who wants a vaccine can get one as quickly as possible. And that's why there's over 300 public vaccination sites across Massachusetts run by a variety of providers like pharmacies, mass vac sites, regional collaboratives, community health centers, physicians' offices, and the like. If you're looking for an appointment at a mass vaccination site, you can pre-register for an appointment at mass.gov/COVID vaccine. It's simple and only takes a couple of minutes to get done. Pretty soon, residents will have the ability to go and make adjustments to their previous pre-registration to account for medical conditions that were newly added to the eligibility list. The mass vaccination sites are highly efficient, and they're doing thousands of doses every single day. Here at the Hynes, thanks to the partnership with FEMA, they're receiving an additional 6,000 doses a day, which allows them to do 7,000 shots. Even if you pre-register, you can continue to look for appointments at other sites via the state's VaxFinder tool at mass.gov COVID vaccine. As I said, I got my first dose today. I pre-registered, was notified last week that I was now eligible to make an appointment, and I did. And so far, I feel great. And I just want to say that this vaccine is a critical tool to help end the pandemic. It's also a critical tool to help people feel safe and to help them protect themselves, their families, their friends, their co-workers, their neighbors, and their community from the virus. The vaccine's safe. It's gone through the same clinical testing protocols as other vaccines have. There are now something like 500 and some odd million doses that have been administered since this process began last fall. And if you have questions about the safety of the vaccine or potential side effects, you should talk to your doctor. You may experience some side effects from the vaccine, but as the nurse downstairs told me, that's just a sign that the vaccine is taking. And you certainly won't get COVID from the shot. The COVID vaccines also protect you from the new variants, of which there are several now, not just here in Massachusetts, but around the country and around the world. And that's one of the reasons why we're working as fast as we can to get shots into the arms of everyone who wants to get vaccinated. We've built up a significant vaccine infrastructure that has the capacity to handle far more doses than what we actually get from the federal government on a weekly basis, and we look forward to seeing increasing supply coming from them as we head toward the end of April and the beginning of May. This week, the federal government has directly allocated 385,000 doses in Massachusetts to community health centers, the federal retail pharmacy program, and community vaccination centers. That's in addition to the almost 445,000 doses that have been allocated to the Commonwealth from the federal government. The state allocation includes 198,000 first and second doses of Pfizer, 138,000 doses, first and second doses of Moderna, and about 109,000 doses of the one-dose J&J. While we expect to see increased shipments of J&J in the weeks ahead, right now, this week's significant shipment should be thought of as sort of a one-time allocation. The Community Vaccination Center, which is the FEMA program that supports the Hynes and some of the mobile vaccination clinics that run out of here, is receiving 42,000 doses directly from the federal government. And through direct federal allocations, the federal retail pharmacy program here in Massachusetts will receive 255,000 doses, and an additional 4,500 doses are being sent to the pharmacy program from the state allocation. Community health centers are receiving about 120,000 doses between the state allocation and direct allocation from the federal government. And for the rest of the state allocation, mass vaccination sites are receiving about 116,000 doses. Health systems and healthcare providers are receiving about 164,000 doses. Regional collaboratives and local boards of health are receiving about 118,000 doses. 10,000 doses are going to mobile clinics to support long-term care facilities, congregate care, affordable low-income senior housing, and the homebound vaccination program that we launched about 10 days ago. Between the federal allocation and the J&J shipment, we have seen an increase in total doses shipped to Massachusetts, and we continue to outperform almost every state in the nation on how quickly we can turn that around and put it in people's arms. In closing, over 2.5 million people have received at least a first dose here in Massachusetts, and there are clear signs that we're getting a little closer to returning to normal. Many businesses are starting to reopen. Vaccines are letting families see their friends and family that they haven't been able to see for months. And this week, many elementary schools across the Commonwealth that have been remote only returned to the classroom. 90% of all elementary schools are back completely in person as of this week. That's 930 elementary schools covering more than 300,000 students across Massachusetts. But we all need to hold on just a little bit longer till we get past this pandemic. More and more people are getting vaccinated, which is terrific news, but we all still need to keep our guard up until we can get this virus behind us once and for all. People need to keep doing what they've been doing for the better part of the past year. Wear a mask when you're out in public, socially distance, get tested if you've been around anybody who tests positive for COVID, and if you're sick, stay home. And try to keep your informal gatherings small. And if you can stay within the bubble of those you are closest to until you and they get vaccinated, that would be terrific. And when it is your turn, go get vaccinated. And with that, happy to take questions. My message would be that the process worked pretty much as it was supposed to. I pre-registered when a couple days in advance, when it was announced that my age quartile would be eligible. And 2 weeks later, I got a notice that told me I was eligible to make an appointment, and we're here today.
Governor,
the process is working.
A lot of friends of mine have said when they got vaccinated, they found it to be an emotional experience, kind of reflecting back on where we've been. You just got vaccinated. Did you feel a little emotion there? Not just the shot in the arm, but after all of it?
I think for all of us here in Massachusetts, around the country, and probably around the world, this has been a year unlike any other, and it's been filled with a tremendous amount of heartbreak and anxiety and lost opportunities and at the same time, tremendous acts of kindness and grace. But I think for all of us, there's simply no question that the arrival in such a short period of time of a vaccine that works is a giant sigh of relief. And I have heard the same thing from friends of mine who've been vaccinated. I heard it from my father, who said that getting vaccinated was, for him, it was the first signal, the first sign that he might actually be able to hug his grandchildren. And I think for all of us, one of the biggest and most emotional elements that's associated with getting vaccinated is the possibility and the opportunity to once again be able to show some love and affection to those we care about most, who for the most part, you know, if we've been playing by the rules, we've been pretty much staying away from for the better part of the past year.
Governor, am I right that you received the Pfizer vaccine?
Yes, you are right. How did you know that, Jonathan? I did receive the Pfizer vaccine. Oh, did you really? Okay, yeah.
J&J is coming here, but it's
Yeah.
not here yet. So for those who might still be reluctant, you touched on this during your remarks. As you set an example as the leader of the state, how can you reassure people that, hey, I got it, it's safe?
Honestly, I've said all along that I think the most important person you can probably talk to about this would be your own clinician, because clinicians believe in the vaccine and want to see people get vaccinated. I think the other thing I would say is just look at what's happened to case counts and to hospitalizations among those over the age of 75. I mean, if you just go back to January, you don't even have to go back to November or December. If you just look at the data from January forward, the number of people over the age of 75 in Massachusetts who are testing positive has dropped like a rock, and the number of people who have ended up in the hospital has also dropped like a rock. And at that same period of time has been the period of time when, for the most part, we focused on those people who we were most concerned about, the most vulnerable and the most senior among us. And that's not just been true here in Massachusetts, that's been true pretty much everywhere. And I think it's a big statement about both the safety of the vaccine. Remember, these are the most vulnerable people among us that we've been vaccinating. And secondly, the success rate it's shown with respect to reducing both their hospitalizations and death and cases in the first place.
Governor, there had been some concern about like Easter gatherings and Passover gatherings leading to a surge. Do you think we might see that, and when could that happen?
Usually we're talking maybe 7 to 10 days after the events. And I think, you know, frankly, our data has been relatively flat for the past few days, but obviously we're going to pay a lot of attention to that. I do take some comfort from the fact that when I look at the national data, I draw two conclusions from it. The first is we continue to test a lot more than many other parts of the country, which means we are catching positive cases as a result of our testing program. People in Massachusetts do appear to continue to be getting tested. That's really good, because that's in many respects how you identify cases. But the second thing is even among states that have case counts on a per capita basis that are similar to ours, or even in many cases significantly below ours, our hospitalization rates per capita are actually lower than many of those states, which says that we are catching cases and we are keeping people out of the hospital as a result. And I do think the fact that such a significant portion of our over 75 and over 65 population has been has been vaccinated, has also helped there as well.
Governor, there's a vaccination clinic taking place in Russell Auditorium. We all have to bring people walk in and get that vaccination. Did the administration sort of squash that because people were just walking in, they weren't really eligible? This is an area that has been hard hit, trying to fulfill those appointments. Your take on that?
So first of all, that clinic is run in partnership with Boston Medical Center, and Boston Medical Center has been a champion of partnering with local-based community organizations, faith-based organizations, community health centers, and others to do outreach into communities of color and into those parts of Greater Boston that have been most disproportionately affected by COVID. And I talk to the CEO there twice a week, and she always updates me on how they're, not just how they're doing with vaccines, but how they're doing in vaccinating some of the populations that they and we are most concerned about getting vaccinated. I think what happened yesterday I would refer to as an honest mistake. People have been talked to. I don't anticipate it will happen again, that they will follow the rules and play by them as everyone else who's vaccinating people in Massachusetts should. But Boston Medical Center and the partners they've been working with have really done a great job of reaching a lot of communities and a lot of people who we need to reach.
So should people wait if they're not eligible?
Pardon me, Paul?
People wait if they're not eligible then to get that vaccination?
Well, the whole point behind the way the eligibility criteria was established in the first place by our Vaccine Advisory Board was to make sure we got to many of the communities and many of the people who were most disproportionately affected by COVID and most vulnerable to it. And I think our program overall has been quite successful in doing that, and it's borne out, as I said, by the hospitalization data that we see here in Massachusetts. I would also say that, you know, we have been trying to make sure that each phase gets a significant opportunity for those who want to get vaccinated. We plan to be open to everybody by April 19th, which, by the way, I was glad to see the president decided to pick April 19th too. I was terrific that he followed our lead. And I think one of the things that's important to remember here is the percentage of our population that's gotten a first dose, the percentage of our population that's fully dosed is significantly above almost every other state in the country and is number one among all states that have more than 5 million people.
Is the First Lady going to get hers? Did she get hers?
The First Lady pre-registered and then went and got an appointment at CVS and got dosed about a week ago and unregistered as a result of that. I think most colleges are probably going to discuss whether or not they want to make a vaccine sort of a requirement of coming back to school in the fall. I think it's going to be an issue they're all going to talk about. I think the thing that's important to remember on that is not every college kid, well, every college kid probably will qualify to get vaccinated at some point starting in April or May, and they should. I mean, for their own sake and for the safety of themselves and their families and their fellow students and teachers and staff.
Do you think we're going to be able to reach herd immunity given the amount of infection we're seeing in the under 30 crowd? April 19th comes. Is that going to be a big push? Let's get the young people vaccinated and then reach that level where we're all safe.
I think, well, first of all, remember that part of the reason why the percentage of young people who are, why the percentage of people who are testing positive among younger folks is going up is twofold. Number one, there's been a really significant reduction in the number of people over the age of 60 who are testing positive. I mean, if you look at the raw numbers overall, we're still way below where even the where even the folks under the age of 50 were in January and February, okay? I mean, we have a little bit of a dip, a little bit of an uptick in March, but we're still way below where we were earlier in the year. I think the message I would send would be, if you talk to the folks in the hospital community, they're thrilled that they aren't seeing as many older folks as they used to see, but they will definitely tell you that they are seeing younger people, folks in their 30s, 40s, and 50s in the hospital. And this is not the time for people to let down their guard. People should still pay attention to the rules and do the things that have prevented the spread and kept people safe from the beginning. And when you have a chance to get vaccinated, when your term comes up and you become eligible, go get vaccinated.
Thanks, everybody. Washington Post had an article today linking some of the infections among younger people to youth sports, high school sports. Is that something that you're looking at, keeping a close watch on, and should youth sports maybe consider skipping the season to get over this hump?
So we spend a fair amount of time. First of all, we have a lot of rules and a lot of guidance around youth sports. In fact, we have guidance on a lot of things where there's not guidance in many other places. And they were developed in conjunction with our reopening advisory board and some of the healthcare folks that we talk to on a pretty regular basis. We do track what's going on with youth sports. And you may recall earlier this year, we basically shut down youth hockey for a couple of weeks and changed many of the rules and the guidelines associated with both tournaments and interstate play because of the rising cases we saw associated with that. And if we see significant issues and problems with some of this stuff, we deal with it. The flip side of that is I have to say, we've made it through a fall sports season and a winter sports season with people playing by the rules and doing what they were supposed to do. And for the most part, case counts were pretty low. It actually worked pretty well. And it gave kids, many of whom, haven't been able to get out of the house at all, something to do. And I think for a lot of them, it was a really positive, not just physical development, emotional development as well. Bruce?
On Friday, your administration withdrew the air permit for the biomass facility proposed in Springfield. Have you been able to get a sense of your administration is always also pushing RPS regulations to subsidize such facilities? Are you withdrawing those as well?
Those are currently under review. I think the issue with the biomass facility was we felt it just simply wasn't, where it was in the process wasn't consistent with the terms and conditions of the original approval, which took place, I think as most people know, if they've been following this issue, in the Patrick administration. I mean, that's how far back this thing goes. A lot's happened since then.
But the letter, your agency also raised some environmental issues.
Yep.
I just wondered, the subsidies, are you going to put those aside too?
I'm not going to speak to that until we actually promulgate, but we'll be promulgating on that shortly.
Thanks, everybody. I just wanted to ask about revenues. They continue to come in over benchmark, including in March, where there was more than revenue collections total more than $3 billion, almost 27% above benchmark. The House Ways and Means budget is due any day now. Do you think that we should be shifting away from that big draw on the rainy day account, given the fact that revenues are coming in so high?
I would think that by the time we get to the end of the year, we'll see where we are, obviously, but the rainy day fund was there. A lot of us worked really hard over the last few years to triple the size of the rainy day fund so that it would be there when it was raining. And I think one of the things we'll definitely talk to the legislature about is, and we have talked a little bit with them about it at this point, is about replenishing the rainy day fund, because it's really important that Massachusetts continue to have, for the future period, a very robust rainy day fund. It really proved its mettle early on in the pandemic.
Thanks, everybody.
Thanks, everybody. How's your arm?
How's your arm feel?
Feels fine so far, although I got to tell you, it's a real shot.